Welcome back, and thank you so much for staying tuned. That is to CAC in the morning right here on CAC TV. Earlier on, we were just looking at infertility. That is both for men and women. We've been able, with the help of Faith Kemunto, to just look at the causes as well as the treatment options in the market. Remember, if you're just joining in, you can always get the conversation via social media. That is Facebook and YouTube at CAC TV Kenya. And as I mentioned earlier, today, that is every 14th of November, the world marks World Diabetes Day. And as I mentioned earlier on, definitely that is at the Ministry of Health will be having an event just to continue sensitizing and creating awareness about diabetes. That is both for diabetes type 1 as well as diabetes type 2. Not forgetting that is a gestational diabetes, the diabetes that comes about during pregnancy. And we'll now just get to listen in. That is from Dr. Eric Njenga, who is a diabetologist at Aga Khan University Hospital, just trying to help us understand what diabetes is, how it comes about. He'll just be focusing on the 3 types of diabetes as I mentioned earlier. So first, let's listen in to Dr. Eric Njenga.
Move straight to our topic, which is just looking at different types of diabetes, with particular emphasis today on type 1 diabetes. So what is diabetes? And diabetes comes about because there's a problem with regard to the production of insulin in the body. Now, insulin comes from a very important organ in our body called the pancreas. And we have very important cells that are in the pancreas called the beta cells. And we have other types called the alpha cells. So when we have destruction of the beta cells specifically, then now we have a problem with regard to the amount of insulin that is produced. And in certain settings, you can have what is called autoimmune destruction of the beta cells, where you basically have antibodies that are produced abnormally by the body, which instead of doing their correct role of trying to help the body fight infection, then they actually turn against the body's own cells. So it's similar to what is called a civil war. So the army, most times in any particular country, does an important role of protecting the citizens. But you may have a situation where the army may go rogue and start to attack its own citizens. So that's what basically autoimmune conditions mean. And there are several types of autoimmune conditions, diabetes being one of them. But you can have antibodies being formed abnormally, and they could attack, for example, your joints, and you can get rheumatoid arthritis. They could attack your thyroid gland, and you can get hypothyroidism. They could attack your kidneys, and you get conditions like lupus. So when specifically they zero in and attack the beta cells of the pancreas, which are the ones that specifically produce insulin, then that's when now we start to get type 1 diabetes specifically. And also other conditions, for example, if you have excess accumulation of fat, it makes it very difficult for insulin to actually work in the body, and that's called insulin resistance, which now leads to another type of diabetes called type 2 diabetes. So we also have the role of the alpha cells, which play a bigger role in the setting of type 2 diabetes. And these tend to produce a hormone called glucagon, which also makes it very difficult for insulin to act. We call it a counter-regulatory hormone. Because what it does specifically is that once it's released, it goes to the liver and causes the liver to actually produce or release excess amounts of glucose into the bloodstream. So diabetes can be viewed as an abnormality, specifically affecting the beta cells, which are destroyed by antibodies, like in the setting of type 1 diabetes. In the setting of type 2 diabetes, the function of the beta cell is also severely compromised, predominantly because of excess fat tissue. So you tend to get breakdown of the fats, which now makes it a very toxic environment for the beta cells. And as the sugars progressively rise, the high sugars themselves also become very toxic to the beta cells. Then we have the alpha cells producing glucagon, which will now lead to a further release of glucose into the bloodstream from the liver. Okay. We also have another type of diabetes called gestational diabetes, which is what we see in the setting of pregnancy. And again, women who get gestational diabetes tend to have certain risk factors which make them more predisposed to developing this condition. So for example, if the body mass index of a lady before pregnancy is above 30, so if she is overweight with a high body mass index of above 30, her risk of developing gestational diabetes is high. Any person with a family history, if you're looking at the first degree relatives, meaning your father, mother, or brother or sister has diabetes type 2, there's also a bigger risk. If you've had previous multiple pregnancy losses, that should be a key factor to make someone look very hard for diabetes in the setting of pregnancy. Or if you get unexplained stillbirth, where a baby is born and dies a few days after birth, or dies within the womb, then again, these are all conditions that should point someone towards thinking about diabetes. So sadly, women lose pregnancies multiple times, and at times they're not screened for diabetes. So very, very important that every woman who is pregnant at 24 to 28 weeks must be screened for any possibility of gestational diabetes. And these are simple tests which can be done. And it's done in the lab, where they simply give the lady a glucose load, and they check her sugar before the fasting sugar, which is in the morning, before she has anything to eat. She gets the glucose load, then they check the sugar again at 1 and 2 hours. Then based on that, we can decide, does the lady have either gestational diabetes or that's completely absent in that particular setting. Again, there are scenarios where women can develop diabetes very early in the pregnancy. Like I said, we test at 24 to 28 weeks for gestational diabetes, but you may find a woman at 12 weeks, 14 weeks having very high sugars. That likely means that she had type 2 diabetes, which was not diagnosed. Then she ended up getting pregnant, and when you get pregnant, the placenta itself produces a lot of hormones which make it very difficult for insulin to act. So we get very high levels of progesterone, for example, estrogen, and what is called human placental lactogen. So all these, they do the same thing that fat tissue does. So they create a lot of insulin resistance, and you require much higher doses of insulin from your pancreas to try and control the sugars. So if you don't have an adequate supply or reserve of beta cells, then that's why you start to manifest with gestational diabetes. And very important that any lady who has been diagnosed with gestational diabetes needs to be screened after delivery for the rest of her life, because the risk of developing type 2 diabetes is around 30 to 50%, which is fairly high. So I start to manifest with gestational diabetes. And very important that any lady who has been diagnosed with gestational diabetes needs to be screened after delivery for the rest of her life, because the risk of developing this, every year she must have a fasting blood glucose checked, or a test called HbA1c, which I'll explain a bit later when we come to diagnosis, to at least ensure that she does not progress from gestational diabetes over to type 2 diabetes. Okay, so those will be the main types, and that will be the basic mechanism of how people get diabetes.
Well, that is Dr. Eric Njenga, a diabetologist at Aga Khan University Hospital, just trying to help us understand what diabetes is and the different types that we have. That is type 1 diabetes, type 2 diabetes, and gestational diabetes, which happens during pregnancy. He's been able to explain to us of how both or just among the three diabetes, how exactly they come about. We'll now be looking at some of the signs that will present themselves for you to know that you have diabetes. That is for both type 1 diabetes, which according to Dr. Eric Njenga is most likely to affect children. Type 2 diabetes, which comes later on in life as age progresses. But this does not mean that a child or someone young can actually get type 2 diabetes. Let's listen into some of the signs that will present themselves. That is for both type 1 diabetes and type 2 diabetes.
So very, very common. In fact, one of the common presenting symptoms for type 1 diabetes is frequent urinary tract infections. And these are quite common in children. So kids who are presenting with recurrent urinary tract infections, candidiasis, recurrent candidiasis in young girls, and also for women who are presenting with recurrent candidiasis in adulthood, one of the key things to think about is to look for diabetes, either type 1 or type 2, depending on the age. Another common infection is skin fungal infections, especially very common, for example, in the genital region. If you look at the folds of the groin, we tend to get the commonest sites because there's a moisture there. Those are very common sites for infection. In between the toes is a very, very common site of infection. And a lot of people who have type 2 diabetes or type 1 diabetes, we always make it a point that you must examine their feet, because you'll find that there are very extensive fungal infections between the toes. That fungal infection creates a break in the skin, and again, that can be an entry site for infection. So once bacteria colonize that particular area, then again, you can end up having the complication of diabetic foot. Nail infections, fungal nail infections, what you call onychomycosis, is also very common. So those are the common sites of infection that we see. Thrush in the mouth can also be another symptom that can suggest that someone has underlying diabetes. So as doctors, we look for those key areas. Genital tract, either UTI or candidiasis, which can occur both in men and women. Again, fungal infection in the skin, in between the toes, and also oral thrush in the cavity. Recurrent flus, recurrent pneumonias which are unexplained, are also things that you have to look out for. Yeah.
Well, those are just some of the signs that will present themselves. That is as far as type 1 diabetes is concerned. For type 2 diabetes, some of the things that probably you should look at are things to do with probably tiredness, frequent urination, as well as thirst. You can also just get to know that you could be developing type 1 diabetes if you have blurry eyesight. This is where you are not able to see properly. Then you need to go and see a diabetologist for a diagnosis or just for checkup. Remember, as Dr. Eric Njenga has just pointed out, actually that is an amputation of the lower limb is actually one of, or amputation of the lower limb is one of the major causes of type 2 diabetes, as well as blindness. So these are just some of the signs that you should look at just to be able to prevent diabetes, or for an early diagnosis of diabetes. As I mentioned, that is the educational video that is from Dr. Eric Njenga, was coming to you courtesy of the World Health Organization, that will actually be marked today. Actually, that is the Ministry of Health is already having a function that is as far as the World Diabetes Day is concerned. And I'll just be updating you on what exactly the Minister of Health, or the CS of Health, that is Susan Nakhumicha, will just be speaking as far as diabetes and more so insulin is concerned. Thank you so much for tuning in. I think that is where we leave KAK in the morning at. Thank you so much for keeping me company from 8 a.m. until now. If you're just joining us, you've missed a lot, but you can always find them on our social media, Facebook and YouTube, KAK TV Kenya. My name is Aida Munzatsi. I'm wishing you a blessed Monday.